Today we're going to think about the pathology of the bladder and prostate. There are three big areas that we need to learn about the pathology. Firstly, infections of the bladder and prostate, then tumours, and finally, benign prostatic hyperplasia. Bladder infections are very common. I'm sure many of you out there will have personally suffered from a bladder infection. The most common organism is E. coli, though other gram-negatives also commonly cause bladder infections. You'll learn much more about them in your microbiology course. The primary cause of them is urethral trauma, for example with catheterization, which is why paraplegics are especially prone to bladder infections. Remaining with the bladder, the most important tumour of the bladder is papillary transitional cell carcinoma. So this originates in the transitional cells which line the bladder, and people particularly at risk of this cancer are smokers and people exposed to industrial chemicals. The red flag for this cancer is hematuria. Bright red hematuria really needs to be investigated promptly to make sure there is no papillary transitional cell carcinoma. This is a papillary transitional cell carcinoma. Notice the fronds. The definition of a frond has a central fibrovascular core covered by epithelial cells. This is what makes a papillae. You can see it on the picture next door. Imagine these macroscopically. They're going to look like little cauliflowers. Let's move along from the bladder and think about the prostate. Prostatitis is an important pathology. It can either be acute or chronic. In acute bacterial prostatitis, E. coli is the main causative organism, and like bladder infections, it tends to be ascending infection. Chronic bacterial prostatitis can be rather difficult to diagnose. Low back pain, a bit of dysuria, and suprapubic pain. The common bugs that cause infection acutely can also cause chronic bacterial infection. And then we have chlamydia. Chlamydia can cause chronic infection of the prostate. Now, as you remember from your earlier courses, chlamydia is not actually a bacteria. So sometimes this is called a bacterial infection. Benign prostatic hyperplasia is one of the most common diseases that affects older men. With age, the prostate increases from its small walnut size in young men up to about the size of a tangerine or mandarin in older men. This is due to androgen-mediated growth, dihydrotestosterone. In benign prostatic hyperplasia, it's the central zone that increases in size. You can see it in this macroscopic picture. The central zone, those two big lobes, have increased in size and compressed to the peripheral zone. There is minimal, if any, increased cancer risk in people who have benign prostatic hyperplasia. Prostate cancer is the commonest cancer in men. It's very common. Up to 80% of men will get prostate cancer if they live long enough. Most of it can be subclinical, however, tiny foci that are just found at post-mortem examinations. We know that prostate cancer has a genetic basis. This is shown in two ways. Firstly, in relation to genetic groups. It's higher in European and African genetic groups and lower in Asian genetic groups. Prostate cancer also is related to family history. It's one of the cancers that's most closely related to family history. So always remember to ask about prostate cancer in the relatives of men. It's also related to the BRCA gene, which we usually associate with breast cancer. On the right here is a picture of a prostate with prostate cancer. In the central zone you can see that there's also benign prostatic hypertrophy. But in the peripheral zone, so there is this small nodule. Now, prostate cancer occurs in the peripheral zone, in contrast to benign prostatic hypertrophy. This is why when we biopsy prostate cancer, it's usually done through a transanal route, because the prostate is lying there against the rectum and can easily be reached by a biopsy gun. Prostate cancer is an adenocarcinoma. This means that it's made of glands, and here on the right hand side we can see a picture of prostatic cancer. It's made of numerous glands pushed together, lined by a single layer of epithelium. The patterns it forms can be quite complex. This has got a gland-in-gland or cribriform appearance. Prostate cancer metastasizes to the lymph nodes and particularly to the bone, where it can have both an osteoblastic, in other words a sclerotic, a bone-forming appearance, and also an osteolytic appearance. There are many options for treating prostate cancer. Hormonal manipulation is used most commonly now, but also surgery and radiotherapy in young men and people who want a cure rather than a palliation is an important treatment mode. So in this video we've thought about infections of the bladder and prostate, and in the prostate we've thought about acute and chronic infections. We've thought about tumours of the bladder and prostate. In the bladder it's transitional cell carcinoma, which looks like little cauliflowers and papillae, and in the prostate these appear as nodules in the outer part of the prostate. And then we've thought about benign prostatic hyperplasia, the commonest disease that affects older men, that is due to expansion of the inside of the prostate and makes the prostate increase in size from a walnut to a mandarin. By learning about pathology of the prostate and bladder, you too can become a pathology superhero.